Thank you for joining us for our final Living Well Beyond Cancer presentation of 2023. Today's topic is the importance of being your own advocate. The team at Revital wants you to be able to do the things that are important to you, things like going for a walk, returning to or continuing to work, spending time with your family, loved ones, activities that are important to you, and advocating for yourself. Our therapists are trained to help you identify and achieve these goals, and today's topic is going to talk more about the advocacy field. We are honored today to have a panel presentation with people who have a lot of experience in this space. So our panel today involves Ari, Shelley, and Amanda. Ari joins us as a cancer survivor. Ari is a 54-year-old who graduated from the University of Syracuse in 1991 with a BS in psychology. He has spent the majority of his career as a self-taught software engineer, designing and implementing solutions for clients in a diverse set of industries, including healthcare. In 2020, he combined his dream of entrepreneurship with his passion for helping others and owns PA State Home Care Agency, where he strives to make a difference in the lives of those less fortunate. He is highly passionate about fitness and life coaching and being his own advocate. Shelley Fognasso is CEO and leads public policy activities at NCCS at a time of rapid and fundamental healthcare change. Prior to joining NCCS, Shelley served in a leadership role at Susan G. Komen Foundation, where she leveraged Komen's grassroots networks in DC and state capitals. Under her leadership, Komen secured an $80 million in state funding for cancer screening and led a team of staff and volunteers to influence state budgets and legislation. She and her team have also expanded Komen's grassroots advocacy program from a pilot of 7 to more than 100 affiliates across the country. She is a graduate of Rice University and holds a Master's of Public Policy from the Harvard Kennedy School. Shelley's commitment to the work of NCCS is strongly tied to the experiences of her dear friend, Dr. Brent Whitworth, a beloved physician who was diagnosed with stage 4 cancer just before his 42nd birthday, who passed away sadly 19 months later. Through Brent's experience, she witnessed the strengths and the flaws of the cancer care system and embraces the notion that policy change can make cancer care better for patients and caregivers. And leading the presentation today is Revital's own Amanda Hodges. Amanda is an oncology certified RN who joined Revital in 2018. In her role, she assists in bridging the communication gap between the worlds of oncology and rehab services. Amanda spent 18 years with the Center for Cancer and Blood Disorders in Fort Worth, Texas, holding roles from infusion and radiation nurse to site manager and director of clinical programs and support. So without further ado, I will let our panel get started and let us learn all about how to be your own advocate. Just a reminder that the medical conditions discussed are intended as an approach of view, a statement or opinion of the presenter, which may be helpful or of interest. Under no circumstances is it designed as medical advice. So thank you. If you have questions, please put them in the chat and we will answer them throughout this presentation. And I will let you take it away, Amanda.
Thank you so much, Kirsty. And I want to put out my own welcome to Shelley and Ari for joining us today. This is going to be very much a discussion between the four of us. So again, as Kirsty said, everyone that's joining us, please put any questions or comments that you may have into the Q&A because we want to involve you as much as possible into the discussion today. One thing that wasn't on my bio that Kirsty read is, I'm not only a nurse, but my journey really started as the daughter of a patient affected by cancer. My mom was diagnosed with stage 4 ovarian cancer when I was just in high school, and she underwent 10 years of various treatments, periods of survivorship, and ultimately end of life care. So this topic of advocacy is really near and dear to me because of my personal experience as well as my years of experience as an oncology nurse. So hopefully we're going to share some great hints and tips with everyone out there today. So before we really jump into some of the panel discussion as a team, want to touch on what it means to be an advocate for yourself or to be an advocate for a loved one, and then get into some of those best practice tips for you. So what does being a self-advocate really mean? It is, as you see in the bullets on the screen here, it's the ability to speak up for yourself and the things that are important to you. It's asking for what you need and for what you want. It's telling others all about your thoughts and your feelings and sharing those things that are important to you. Knowing your rights and responsibilities as a patient, and ultimately making the choices and the decisions that affect your life that are best for you and your care team. And then why self-advocacy? Self-advocacy really empowers you and makes you that active participant in that decision-making process and how it's going to affect you in your life. When you really advocate for yourself, it gives you some control in what's happening in that moment instead of everything just being done to you or at you. This to me is so incredibly important because it opens up the dialogue to let you really help decide what you want and what to expect in your care and throughout your journey. Ari made a really great point when we were chatting yesterday, getting ready for today, and that advocating is not just advocating for yourself in your medical decisions. It's also really advocating for yourself with your family and your friends in your work environment. It may include your faith-based community or other organizations that you're really involved in. So without further ado, let's kind of jump into some of these topics and get the discussion going with the panel. So Ari, let's start with you. So how do you feel that you've self-advocated for yourself in your journey?
Hello, everybody. It's an honor to be here. I just to give a quick background, I was diagnosed with renal cell carcinoma in October of last year. It was later discovered that it had unfortunately metastasized. I had a major surgery in which they were able to save 70% of my kidney, which I thank God for every day. I had an unbelievable team, and I've learned that my kidneys work better than a person with 2 full ones. So I was clearly in great hands. For me, it's basically 2 consecutive miracles. The first one was the surgery, which was highly successful. And now I'm in the battle of the metastasis. That's just a quick background. One thing to mention, before I was diagnosed, for a couple of years, I had these night sweats, and I didn't really think much of them. And I'm only bringing that up because don't underestimate any type of symptom or anything you have. If it raises a question in your mind, you must pursue it aggressively, especially in the interest of, if God forbid something is wrong, that you can catch it early. As far as what self-advocacy means for me, I just wanted to mention a few points. The entire centerpiece of my fight is about a positive attitude. And, having said that, I've also learned that the inevitable ups and downs of this cancer journey are going to happen. And I'm not going to sit here and say I've had a great attitude through the whole thing. And I've learned to take it easy on myself when I don't, because we're human. And if we
Yeah.
start to beat ourselves up, we're going against what the whole point of self-advocacy is. But for me, it's about a positive attitude. It starts with gratefulness. I can give two quick examples of what I'm grateful for. The first one is the fact that I did have a stage 4 diagnosis, but that late diagnosis ended up being a tremendous blessing because immunotherapy, which is my treatment, was not approved until 2021. And if I had been diagnosed sooner, my prognosis just would not have been very good, to be honest. So I'm really grateful for that. Realizing the lucky breaks I've had. The other thing that's really just I'm so grateful for is the friends and family support that I have around me. It's even more intensely appreciated because when I was in the hospital after surgery, I had a neighbor who literally had nobody. He had no friends and no family. And that really impacted me very, very much. And I've never forgotten it. And I'm very thankful for that. The other two quick points are, and what has really been another centerpiece is the weaponization of my fitness. That entire tide was turned when I met Revital and Rita, who was my cancer rehab therapist. She immediately lifted my spirits. It was very scary after such a surgery to use my body again. And the last one, which I can comment on later, which you might find strange, is I'm a big advocate of visualization. And I basically studied my scans. I learned everything I could about what I'm up against. And I do very deep meditation and I visualize going inside of myself and honestly killing this cancer. And I really believe it's had an impact. I've had some really great scans. I'm killing this cancer and I will defeat it.
Oh, I love that. Love that. Love that. Thank you so much for that insight, Ari.
Yes.
We're going to dive into some more of that stuff in a little bit, I'm quite sure. Shelley, what does self-advocacy really mean to you as well?
Thank you so much for having me. And thank you, Ari, for sharing your story. I really loved hearing that. My friend who died had renal cell carcinoma, and he died in 2012, and he didn't have these immunotherapies. So I'm just grateful that you have them and that you're doing so well now. That's wonderful.
Thank you so much.
Self-advocacy is important throughout the cancer journey, unfortunately. I mean, I wish for a healthcare system where you don't have to be an advocate to get the best care. Because when you're faced with a cancer diagnosis, honestly, you shouldn't have to be that advocate for care, but it's just the way our healthcare system is, you have to. And that starts at diagnosis. We do a state of cancer survivorship survey every year. And last year we asked about, we change up the questions each year, but in 2022, we asked about misdiagnosis, and about 10% of people had a misdiagnosis initially, but that was higher for some groups. And, it was really highest among young adults. And it was 2.5 times as high for them. So, they're the ones who go and say that something's wrong and they're told, oh, you're too young for that. You're too young to have colon cancer at 25. My nephew is named after my brother's best friend from college who died at 25 of colon cancer because his symptoms weren't taken seriously because he was told he was too young. And by the time they finally took him seriously, it was stage 4 cancer. And so you have to be an advocate, like Ari said, to get that diagnosis if you know something's wrong. But you also have to advocate for the right treatment. A lot of times there are multiple treatment options and you have to figure out what's right for you. And sometimes that means asking for a second opinion. And a lot of people don't feel comfortable asking for that. They don't want to upset their doctor. If your doctor is upset by you asking for a second opinion, they're not the doctor that you should have. They should welcome it. A lot of times people sometimes, they're worried they're going to upset their doctor or their doctor's going to think they're going to leave them. Sometimes getting a second opinion just confirms what you were planning with your original doctor. Sometimes if you have a rarer form of cancer, you really need the specialist in that. And a lot of time, I've heard a lot of stories of people who get that second opinion from somebody at an academic medical center who may be an expert, but they still stick with their doctor in their community to deliver that care. So it doesn't have to mean you're leaving that doctor. It just means you need that confirmation for yourself that you're on the right path. And then also, when there are multiple treatment options, you need to have your perspective, what's important to you, considered in the decision making. We see every year in our survey that patients are still more likely to have a sort of doctor knows best philosophy and let the doctor decide what the right treatment is. And I think that's changing over time. Younger people are less willing to do that. But it's still, again, when you're faced with that cancer diagnosis, there's nothing wrong with saying, I don't know, you tell me what the right thing is. But even if you're relying on your doctor to make a recommendation, it should be based on what's important to you. If you've talked about, I'm a piano player, so a treatment that's going to give me neuropathy is going to be really a problem for me. So can we think of something else? Because there are almost always multiple options, and unless with the exception of certain, really emergent cancers, you have time to make a decision. You have time to seek out those opinions. And then also, I think self-advocacy is important when it comes to all of the side effects that happen during treatment and after, and the long-term living, well after a cancer diagnosis and after treatment is done. We don't do enough to support people's mental health. So sometimes you have to advocate for that and asking for support for that. A lot of times patients are afraid to tell their doctor about some of their side effects because they don't want to be taken off the medicine. But a lot of time, if you talk about it, then they can help you address it. Of course, self-advocacy comes into play when it comes to getting access to rehabilitation care. In our survey, we asked if people had saw different types of providers and how satisfied they were with them. And we consistently see it's only 5 or 6% of people in our survey have had any kind of rehabilitation services. And it frustrates me because this is what can help you live better during and after cancer, but they don't know about it. And it's not, their insurance would pay for it if they found out about it in many cases. They just don't know it's an option. And that's where self-advocacy is so important, because a lot of cancer care providers are focused on killing the cancer, and you want that. That's what's really important. But they don't spend as much time focusing on all the other things that are important about how you live during and after treatment. And so, unfortunately, you're going to have to advocate for yourself to get that kind of care.
And I think a lot of that is how the treatment of cancer has evolved, especially how rapidly it's changed in the last few years. Cancer is not that dreaded C word anymore. People are living with a chronic condition of cancer for years and years and years. So now the importance of getting supportive care services like cancer rehab or dietitian services or just care for those long-term side effects, I think is just so incredibly important.
If it's okay, I just wanted to share something that was triggered about a second opinion, because it's directly applicable to what happened to me. The truth is that I was scheduled for surgery on a Tuesday for a robotic surgery. And I just didn't feel comfortable that the surgeon really was confident he could save the kidney. That was my goal. I was so intent on that. And I literally canceled the surgery. It was a very uncomfortable thing. I almost didn't do it. The doctor reacted very badly, to be honest with you. And on the last day, I found a world-renowned surgeon who I felt so comfortable with, Dr. Robert Uzo at Fox Chase Cancer Center, the CEO of the hospital. And he gave me a choice. He said, I can do the robotic surgery and I'll give you a 60% chance I can save your kidney. But if you let me do an open surgery, which was a tough decision because the recovery is grueling, he gave me a 90% chance. And I gave him that chance, and it was a good decision. So my point is, because you brought up a really important point, the second opinion can be really uncomfortable, but you have to remember it's your body and you have to do what's best for you. And you can't worry about hurting people's egos or anything. And I'm so grateful that I acted on that, because I almost didn't, to be honest with you.
I've heard that. Go ahead, Kirsty.
I was going to say that's so powerful, Ari, and brave of you to advocate on that level for yourself, that you knew, and I think it speaks to a second opinion is education, right? You got more information, and he was able to tell you you're 60% or you're 90%. And the more information we have, the better advocate we can be for ourselves. So thank you for sharing that. It's so powerful.
It really was a harrowing experience, because when you first get diagnosed, it's so overwhelming. What doctor should I choose? What surgeon should I choose? What am I doing? And that was really the craziest part in the beginning. It was frenetic.
Well, and I think
That's the perfect segue to,
Yeah.
our first tip here, which
Yeah.
is finding a care team that you trust and supports you and your decisions, and how important that is.
Yes, absolutely. It's a very difficult path. And I made doctors my God too much. And that really hit a great point that you brought up. And I learned how to just realize they're just human and they have made mistakes. You have to be on top of everything. You have to be on top of your scans. I mentioned yesterday, there was a situation where they chose the wrong comparison scan. It was an honest mistake because I had a lung biopsy when they discovered I was metastatic, and they were using the wrong comparison scan, which when you look at it, looked like my cancer had gotten twice as bad. In fact, it's gotten twice as good. So you got to stay on top of it. They're very busy. They'll come in for 3 minutes to talk to you. You have to press them and say, listen, I got questions,
Yeah, definitely. When we're talking about finding the care team and the care team that's there to support you and that you trust, I want to be sure and point out all of those members of that care team and who it could include. This could include your physicians and your nurses and your pharmacists that you typically would think about. All kind of depends on the condition that's being treated and what areas of the body are involved and who may be included in this multidisciplinary team that's managing you. These teams can become quite large, and hopefully they could include your trusted cancer rehab clinicians as well. That's going to help you maintain your overall function. But I want to be sure and point out too that it also is going to include your family and your friends. Who is on that care team to support you outside of the medical team? This is where your faith-based community can come in. Some of your work colleagues or peers may come into this as well, because this is all going to be that makeup of your overall care team through your journey.
Yeah,
So
absolutely.
do y'all have recommendations on or experiences on how to find your core care team that are going to be there with you through thick and thin?
Part of it was tough for me because until you get to, every doctor has a different personality. The way it worked for me is once I connected and felt within 3 minutes on the Zoom call with Dr. Uzo, I knew he was the one. You just know it. It's like when you're looking for a home, you just walk in one of them and you're like, this is home. And that's really what it was. And quite frankly, after that, I had such incredible trust in him. He directed me to oncology. He took me to the immunotherapy, and then henceforth from there.
What about you, Shelley? What advice would you give someone
I
that's
think
just starting out?
some of it is networking and asking for recommendations from people. I mean, normally you'll get recommendations when you go through the process of getting diagnosed. But again, I think it's also really important to find somebody who has specialty in your type of cancer. Cancer treatment is getting so specialized. And so I think it's impossible for oncologists to keep up with every nuance of every advance in different types of cancer. So especially if you have something that's a really rare cancer, finding somebody who really is a specialist in that is going to be really important, even if it's just for that second opinion to make sure you're on the right track. So I think, and just kind of networking and finding other people who have had the type of cancer that you've had and finding out from them who some of the top leaders are in the field. I know some people just really get a lot of support from, online Facebook groups for their specific type of cancer. And that's where they learn about kind of who are some of the top specialists or what clinical trials may be happening for that type of cancer. And then, patient advocacy organizations for the different types of cancer. There are resources online for clinical trials, but it can be a little bit overwhelming. But, if you have pancreatic cancer, the Pancreatic Cancer Action Network has a great service for helping people navigate to different clinical trials in pancreatic cancer, and they know what's going on and can help you find that more so than just going to clinicaltrials.gov where there's every type of clinical trial there. So, finding the people who know the most about your type of cancer and getting recommendations from them is a great way to find the care team that is going to be a specialist. And then I think Ari's advice on, finding somebody that you just really click with, that's going to be there to support you, is what's really important.
Yeah, just to mention the specialist part you mentioned, that's such a great point, because my medical team is specific specialists in urological tumors, both the oncologist as well as Dr. Uzer. That is their core area. So I ended up with what you just described, and there's no question it helped.
I know in my experience over the years, I worked for the community oncology practice, and a lot of our physicians were generalists that would treat multiple types of cancer. And we routinely would have patients that we would refer out for a second opinion and a treatment plan with a specialist in that specific diagnosis or that field. And again, that patient would then come back to us, and we would follow out those treatment recommendations from the specialist. Especially because so many of those patients were traveling long distances to get that second opinion, and it wasn't feasible, or the logistics would be too hard for them to maintain treatments at those locations. So they would just come back to us, and the physicians would just coordinate with each other to carry out those care plans. And it worked really, really well, and made patients' lives so much better during those difficult times. So
yeah, that's great, because not everybody can travel to one of the, MD Anderson or Memorial Sloan Kettering, and you don't have to get good care. But especially if you can have an arrangement where you get advice from those experts, but then get your care closer to home, that works so much better for patients.
100% agree.
Yeah. One other thing to mention, I just can't get it out of my mind. Stay away from Dr. Google if you can. It's really, it's not, if you read those things, you're gonna have a negative attitude. And I did that in the beginning. And those statistics mean nothing. Every journey is individual. You are your own statistic. And if you go to Dr. Google, these cross sections of stats they get, some people didn't get treatment. Some people got the wrong treatment. Some people didn't get treatment at all. You must stay away from that. I really can't emphasize it enough, because it started my cancer journey on a bad foot.
Yeah. Because there's a lot of good information out there. There's a lot of bad information out there, and there's a lot of scary information out there.
It's true.
All right, well, we'll jump to our next one here. Our tip number 2 for today is knowing and understanding your rights as a patient. I know probably many of us out there have had a surgery or a procedure, or have checked into the hospital, and you sign tons of paperwork, and you're given a copy of the institution's patient bill of rights. But how many people stop and actually even look at it or read it and take the time to really understand what that means? I really believe that as a patient going through a cancer diagnosis and journey, these rights really become really important, because it's not a one and done, you're in and out for a procedure. This typically may be, for many patients, quite the journey. So some of the things that I have listed on here, including rights and that may be important, are it's honoring your right to choose your own provider, which we've really just touched on quite in depth. It's your right to have timely access to care, which I think is very important, that you have a right to not have treatment delays. And there's a lot of aspects to that we could go into. It's that your care is being provided in a safe environment. It's respect and dignity through your care. Privacy and confidentiality as well. And that's where a lot of our HIPAA laws have kind of come from. It's right to pain management, right to information, education, and consent to treatment. Also, it's your right to refuse treatment. That's something I know I could probably tell you several stories about, is a patient's right to refuse treatment. Honoring advance directives, the right regarding your billing and your charges associated with your care, And then you're right to have effective and clear communication, which we're going to go into more detail in a couple of tips on that. What I would love to just really touch on is the refusing treatment aspect. I think that one's a really important one to make sure we highlight strongly, because you as a patient, you have the right and responsibility to be involved in your treatment decision making. And if the right thing for you in your journey is to not do a specific treatment and possibly do a different treatment, as you described, Ari, with changing the surgeries,
Yes.
you've got to stand up for that. And
Yeah.
just like you described.
Yeah, it's true. I mean, obviously I would never bring in names, but the first surgeon I had, quite frankly, he kind of tried to scare me into, he gave me a grim outlook when I decided to, go with someone else. And it was very upsetting because it didn't help me, you
Yeah.
know.
But
So,
I
I
applaud you.
honestly think we
Go ahead.
shouldn't be thinking about it as refusing treatment, but choosing the treatment that you want. Because even if you
Yeah.
decide you don't want chemotherapy, or that you have done enough treatment and you are ready to move on to hospice care, that is not refusing treatment. That is choosing hospice. So I think sometimes the terminology that the medical profession uses isn't very patient friendly. And to me, refusing treatment is one. And even also when we talk about compliance, that's not a very patient friendly term. If somebody's not taking their medication, it's not because they're not being compliant or non-adherent. It's because there's something going on and we need to figure out what it is and help them. Is it that they don't want to take it anymore? Is it that they can't afford it anymore? So I just think, I think it's very rarely does somebody refuse. And even somebody who has late stage cancer who does not want to undergo any more curative treatments should not be refusing treatment, but should be choosing for palliative care and hospice care to support them in their quality of life, even if they don't want to have treatment with curative intent anymore.
Absolutely. That is such a great point, Shelley.
it is huge.
Yes. Language is so important.
Shelley, I have spent so many sessions with patients who felt they were going to hurt the doctor's feelings if they didn't take their, Taxol, but this medication was causing profound side effects that impacted every aspect. And when we flipped the thing and you're not refusing, you're asking for another option, or, what options could I have? It gave them this power to discuss it. Prior to that, they were just very much, I'm just going to do whatever they tell me to do, even if my side effects are miserable, my life, so it is not refusing, it's choosing another option. I love that comment.
That's a great comment.
Yep. I can't agree with this more. I mean, because if I go back to my personal experience with my mom, it's similar experiences, Ari, of had consults with a couple of different physicians when she was initially diagnosed, and ultimately chose to change to a different physician because of the options that were available and the bedside manner and just how we clicked with that care team instead of the other care teams that she had initially consulted with. So
Absolutely. One thing to mention, because you brought up treatment and choosing, I've had a few treatment holidays, is what they call them.
yeah,
I've had pretty tough battles. I've had to fight pneumonia twice. At one point my liver numbers went haywire. But that helped me gain confidence in them. They have managed it beautifully, and I was afraid at first. I don't want a treatment holiday, but it's okay. You don't have to be afraid. These treatments are so advanced, and they really teach your body how to fight cancer on its own.
absolutely. So our tip number 3 is something that I have told patients for probably as long as I've been a nurse, is to bring a list of questions to every single appointment you have and how important this is. Again, circling back to when I was with my mom and we would go to appointments, we had those experiences off and on to where the doctor would be running behind. He would swoop into the room, do the exam, say, do you have any questions? And turn around and run out. And as soon as that door closed, all those questions that we had would rush back into our head, and it'd be like, we forgot to ask this. So have you had that experience at all, Ari?
That happened to me so many times.
Yep. I think it's going to happen to all of us.
Yeah.
Sort of,
And the thing is, you could get intimidated. You can get intimidated, you know, I don't want to ask them too many questions. Everything you said is true about, you know, just doing what they say. If your gut tells you you have a question, you got to ask it, because that's going to hurt your self-advocacy mentally if you don't.
Yep.
Amanda, I have a question for you. So given that you know your doctor has limited time, is it helpful to sort of rank them in priority order? And also, are there questions you could ask your nurse or another person in the practice that doesn't have to be the doctor, so that you know that if they are rushing or you don't have as much time, you get the ones that your doctor needs to answered by the doctor, and you can ask someone else for help with the other questions?
Absolutely. This is where I think it's understanding your care team comes into play. If you are somewhere having treatment where you have a patient navigator, this is the perfect opportunity to work with your navigator to see what questions can they answer versus which ones really need to go to the physician. If your physician has a nurse or an advanced practitioner that works alongside them on your care team, that's where they can come in and probably help prioritize some of those questions as well on what really needs to go to the physician to get clarification on. And I know in this digital age as well, so many folks have access to the online portals to where you can pose questions through portals too, and have a response back for those things that may not be super timely, but you want to make sure you get a clarification or an answer. I highly recommend using those, your portal access, if you have a good relationship and response with your care team that way.
I use it a lot. It's been one of the centerpieces of my self-advocacy. Just one warning about the portal. It's a difficult situation. When you have a scan or something, those results are going to come in before you speak to the person. It's been a very tricky thing, and you can't help it. You're going to open it. And if you can wait, would be better, but you know, they don't schedule the review like, you know, right after you get it. So that's a very tricky thing. I've even had my general physician ask me, just don't look at it, you know, but it's just too difficult not to, for me.
Ari, I have a patient that was waiting on a lung imaging, and his doctor actually said, don't even open it until you come and see me, because it was complicated, and he wanted to have that conversation with him. But yeah, it's a hard place to be when something's sitting in there with all that information.
It is. That portal is it can be a double-edged sword, but it's a powerful tool. I mean, my main advocate isn't really the oncologist as much as the physician assistant to her.
Yeah.
She is extremely engaged with me, and she's my main point of contact, and she answers my questions. And quite frankly, she's managed most of my case secondary to the oncologist.
Absolutely. The advanced practitioner teams are a lifeline in so many cases.
True.
Because most of them were nurses first, so.
Yeah, they were at the grassroots level, that grassroots level.
Let's jump on here. Tip number 4, communicating clearly and being honest with what you're experiencing is the next one. With this one, again, going back into my experience as a nurse, I cannot tell you how many times a patient would come into the infusion room and tell us all about how sick they were or what symptoms they were experiencing. And it's like, well, you just saw the doctor. Did you talk to them about that? No, I didn't tell him because I was scared he was going to hold my treatment. That is a real deal that I heard over and over and over because they were so scared the treatment would be held. Or never called with a symptom and just waited till their next appointment because they knew how busy we were and they didn't want to bother us. Those are real things of communication that I experienced years over years in patient care. If I'm thinking about it, really what's happening is communicating clearly and really sharing this information is being proactive to get ahead of things and getting ahead of symptoms a lot of times before they become more severe. So
It's true. Every time you say that, it hits home for me. Listen, I'm guilty of it. A couple times I really wasn't completely upfront about it because exactly what you said, I didn't want them not to give me treatment. It just so happens I'm on a treatment holiday now. Because I finished the battle with pneumonia. They want to wait.
Yeah.
I listened to a presentation recently on patient-reported outcomes, and the presenter said that when the clinician asks the patient, "How are you doing today?" and the patient says, "Fine," the doctor thinks they've gotten clinical information. The patient thinks they're being polite. And I think some of this, I think as we have more and more implementation of sort of automated patient-reported outcomes, where you get a questionnaire asking you about your symptoms that you complete before an appointment, because sometimes you don't know what should I be reporting or not. So, and I think it's on the care team to be really clear about, if you have this, or this, you need to call me right away. Like, tell them what are the things that require an immediate call us versus things that can possibly wait till the next appointment. But I think the more we automate some of that and make it, really integrated into practice, so that it's not like you're just making somebody fill out a form that no one's going to look at, but that actually guides the discussion, then you don't have to remember to tell them about the symptom that happened a week ago, because you have this questionnaire that you complete, and then the care team can ask the questions that they know are important, that they're looking for. I think that it's a really important way, and it's kind of the way of the future. And, more and more practices are including it, but I think it will be increasingly important going forward as a way to sort of maybe take some of the emotion out of it and just make sure that those patient-reported symptoms and side effects are being communicated.
That's an awesome enhancement to the workflow. It really is.
So Revital therapists use a combo, Shelley and Ari, and it's the Promise Global. And it's a lot of, you might have seen it, it's several pages, but it's great information. And I will have a patient referred and the doctor's like, oh, they have some lymphedema, but otherwise they're doing great. And then you look at their Promise Global and the patient doesn't think they're doing so great. And when we go through that and they're like, oh, you can do something? Oh, great, And the amount of times when I give updates to doctors and they're like, they never mention that. As you said, Shelley, you didn't directly ask, so they're not going to bring it up, right?
And the patient might have even said,
may not know.
Pretty good. But when you ask them more specific questions about what they can and can't do, then they may realize, oh, that's because of my cancer. Yeah, maybe I'm not doing as good as I thought.
It's a matter of knowing what's normal and what's not normal, and what should be reported and what doesn't really require to be reported. I think that, again, Shelley, your point of the patient-reported outcomes and teams using those effectively to guide conversation is going to be how we do this better.
And if you don't use it, don't make people fill it out, because then why do I have to fill out these pages? But if you're filling out a several page survey and then you come into the appointment and they say, well, I see this and this, and here's what we can do, then people will see that, oh, that they are listening. They're using this and they're going to help me with things, as opposed to just making me fill out another form.
Yeah. I know, but in my previous life, when I worked in the cancer practice, we had started a project of patients on oral medications. We would register them to where, based off the medication we had started them on, they would receive a text message to fill out a survey reporting their symptoms in. that were specific to the drug. So some people we would ask them to report every day. Some people we would ask them to report every week. Some people it was once a month. We wanted to know how they were doing. And based off of their level that they reported back on the specific symptoms, that would trigger a nurse to call them and go, hey, let's talk about this. I need to know more.
Especially
If
when
they
you're
didn't
not coming
trigger
in
any
from-
alerts, they
Yeah.
got a message saying, great, be sure and let us know if you have any issues, you know. I
Yeah.
think that's the wave of the future.
Yeah.
And that's how we're going to improve our communication.
Yeah, I mean, for me, listen, the most difficult part, if you call the hospital, it's really hard to get anyone.
Mhm.
So by using the chart, I get a response within 1 day every time.
All right. So our tip number 5 is it kind of goes along with the previous one we just talked about. Because I think if we're being really honest in our communication, it means we're probably asking questions pretty well, but maybe not. We don't want to have people assume that what they're experiencing is normal. And that if you're having a concern regarding any decisions or advice, or that the discussion that you've had just isn't completely clear for you, to be sure and let your voice be heard, to again communicate openly and honestly with your care team that you're working with. It all circles back to your rights and responsibilities as a patient. You have the right to ask questions, to get clarification, and be able to have that discussion with your care team about decisions that you're making together. So has there been a time that either one of you can think about where you really had to just kind of slow things down and ask for clarifying questions? I know, you kind of ran us through the beginning of your journey. Has there been any time since then where it's kind of like, okay, let's stop, slow down, and let's just kind of go through this all the way step by step on what we're doing?
Yeah, I mean, one of the main questions I've had mostly isn't about Keytruda, which is the immunotherapy arm, but the Inlyta, the pill therapy, to target pill therapy that cuts the circulation off of the cancer. And then the immunotherapy unleashes your immune system to wipe it out. But I've had a lot of questions about Inlyta. I could write a whole book on Inlyta. I was at 10 milligrams a day, and I started having some really tough things. They dropped it to 6 milligrams, and I got worried. I'm like, because it was working. So they dropped it to 6 milligrams. They've since gotten me up to 8. But I've asked a lot of questions. My most recent one was, can you get me back to 10? And they seem not to be too interested in that, and I'm tolerating really well now. So I've really hammered them on that one. I'm
So
not
you had
completely.
to answer a lot of the clarifying questions of, why is this dose okay for me, and get that information from your provider explaining why that
Yeah,
is a good dose for you and is doing the job that it's supposed to do for you and your body.
yeah, because at the 10 milligrams, honestly, I was having unbelievable results. They told me I'm heading for a complete response, which feels amazing to hear. But then, the way your mind works, oh no, I'm on less of a dose. Is it going to be as good? So, I do ask a lot of questions about that, and try because it makes you wonder.
Yeah.
I mean, Ari, I had a patient that was really struggling with her taxane-based therapy, and she just felt she was letting her doctor and care team down. And we sat down, we did pretty much everything on this. We wrote them out in advance. We practiced the questions. She went and she'd been seeing this same doctor who she very much liked for several years. And he finally wrote down the risk of reoccurrence if she stopped taking it. She had never been told that in 2 years. And she said, now I know that number. I'm willing to take that risk. That is a choice I am making. But it was 2 years getting to, and maybe it had been said over and over, but you get all that information. Can't keep all that in your head. When she
No,
saw information, she could make the choice that worked for her.
that's a great story, and I'm glad that she was able to put her mind at ease for that, because it really can torment you. There's just so many iterations.
Yeah.
So the next tip is taking notes. For myself, taking notes is a critical component of every doctor appointment for myself because I have a hard time remembering anything when I walk out the door. So I know in many cases, when you go to a doctor's appointment, it's high stress, there's anxiety moments, you're receiving test results or next steps or what's the next treatment plan. And it may be super overwhelming with all the information or the terminology that's being shared. So I can't recommend enough of take notes, take notes, take notes. Another point to bring out here is you may discuss, especially those high impact visits where you're doing a lot of treatment planning, is ask the care team, is it okay to record the conversation? Never record without permission of your care team, but ask if it's okay to record portions of your conversation so that you can go back and listen to it again, so you can take it all in when it's less stress, or be able to also share that even if you had like a family member that wasn't able to come with you, you could share that recording with them as well.
Yes. Actually, that kind of led me just to one quick point, if it's okay. One of the things I did that helped my self-advocacy was I put myself in the shoes of my friends and family. It's hard to do, but I'm thinking to myself, well, what are they going through? To understand what they're going through, because they don't understand. They can only understand it so much. My father understands because he's 16 years in remission from non-Hodgkin's. But I put myself in their shoes because, and at the same time, it's been difficult. You got to set some boundaries. They can really, especially family, you have to set some boundaries because they can hurt you. If like I had a friend real quick, a week after surgery, he was telling me, what I need to do, how I need to do it, and all this stuff. And it rubbed me the wrong way because I'm like, well, how is he giving me advice? I'm the one going through it. So I had to set a boundary with him because it was hurting me, to be honest.
Yeah.
I think you hear that a lot, Ari. They're like, my aunt had breast cancer and she didn't do that. And I always remind people, everyone's an individual, and we know cancer diagnosis are very individualized, no two types are the same, truly. When we look at breast cancer, there's so many different presentations. So I hear that one a lot, that people have and it's out of concern, but it's overwhelming.
It is. It's overbearing. Like I had a point with my family there. You try to take over. I'll set your appointment. I'll do this.
Yeah.
You got to have some intimacy with your own cancer journey that nobody else really gets involved in. I got to tell you the truth.
Mm-hmm.
I'm mindful.
Yeah, we need to be mindful of our time. We've got 2 tips left. So the next one I'm going to go kind of quick over because I think we've touched on it a little bit already. Our tip number 7 is to bring a friend or a family member with you. This goes along with taking the notes and having your care team around you. They can help take notes for you. They're a built-in support system with you to hold your hand during those kind of high stress or high anxiety moments as well. So let's jump to this last one. Oh, go ahead, Ari.
Oh, no, I was just saying, absolutely. I've had my parents sitting next to me in every infusion.
Which is incredible that you have that wonderful support system right there with you.
It's a true gift.
Our last tip that we're going to touch on today is a little bit twofold. I always recommend, it goes along with the previous 2 tips we covered, is to leave with clearly defined next steps. Make sure your next appointment is scheduled if that's at all possible. If somebody's going to be calling you with results or calling you when tests are scheduled, it may be that you have your prescriptions in your hand before you walk out, or waiting to see if they're called into your pharmacy or sent into your pharmacy. And then the second part applies to so many patients affected by cancer. There's so many appointments and tests and treatments that are all being scheduled in a really fast, rapid environment, especially at the beginning of your journey. ask to see if there's the availability to have it all printed out on a calendar for you, or a list of reminders that you can take with you.
Yeah.
Do you have any advice on this, Shelley, on how this could work with patients, or
No, I
have
think
you
you
had
did it
experience?
really well. I do think, knowing what the next steps are is really important, because a lot of times you can, if you don't have that clearly written out, you can walk out and like, what did we just do here? And some, some clinicians are really good about giving you a summary of the appointment and what the next steps are. And if that's not the case, if you're not going to walk out with that, then you should just, verbally confirm it and make sure you're writing it down so you know what it is.
That's why the chart is so valuable. It lists everything, literally everything, your next appointments and everything. It's very helpful to me.
Mm-hmm. I know a tip that I used to share with patients is to do a shared calendar between you and your family members. If you have those trusted members on your care team, that way everybody can kind of see it all in one glance, and not everybody has to just call you and ask what the next thing is as well. So little tip there extra. So I know we're right at the top of the hour. I do want to make sure and just share some of the advocacy groups and patient resources. These are some amazing teams from across the country that I know some various program directors in our network have worked alongside. There are so many more that are not even listed on this slide. I encourage you to explore what resources are available to you, your caregivers, and others in your area, because there are so many local programs that have amazing resources that you can access as well.
Yeah. Could I just speak 1 minute
Sure.
to the Revital?
Absolutely.
Honestly, it was the turning point of everything for me. Rita changed my whole course. She weaponizing your fitness is the X factor. I'm telling you, it makes all the difference. From the time I went to her, I had an encounter before I went to her. From the time I went to her, I didn't have one encounter, and I'm 11 infusions later. I just want to mention that because I'm so thankful. It changed everything for me mentally and physically. It really did.
Oh,
I love to hear
blessing
that.
to have her in your life.
She was a very special person to cross paths with. She's an amazing rehab person. And the one thing is, she inched me along. It was terrifying after getting cut like that. Like, I couldn't use my abdominals. I mean, just to be able to get in and out of bed like a normal person. Little things like that mean everything.
Yeah. I think that's a really poignant place to finish up for today. I want to thank Shelley and Ari and Amanda. It's just such a important conversation. And I think, the takeaway is it's your journey. You are your own advocate. I've never had a doctor not want to hear a question. It's usually that they're just going through their list. But if you have your questions, they will be listened to. And just thank you so much for sharing your valuable knowledge and experiences. And to all of those who've joined Living Well Beyond Cancer this year, thank you. Keep an eye out for your email and social media for 2024 events. And we wish everyone a wonderful and safe and healthy holiday season.